The Muslim community in Jamaica has donated $40 million in medical supplies to the health sector. The assistance comes as hospitals continue to buckle under the strain of overcrowding. The items include critical equipment that have been in demand since Hurricane Melissa hit. Facilities like the Mandeville Regional and St. Anne's Bay hospitals have been struggling to keep pace with the influx of patients from neighboring parishes since Hurricane Melissa. While it may take several more months before normality is restored at most hospitals across the island, the Muslim community has taken quick action to help bridge some of the gaps.
We have accepted containers from overseas partners like Helping Hands. Today we have one of the containers from Helping Hands, which has medical relief items within it. The value of those items is about $40 million. We intend to bring these items and distribute them to the hospitals across the island.
Special focus will be placed on hospitals in the most affected areas, as well as those that have become overwhelmed by patient transfers. So, as soon as a container was opened on Saturday, members of the Portmore Islamic Center and several volunteers started distributing items to representatives from the St. Anne's Bay and Port Maria hospitals.
In the medical container that we are currently sorting, we have many forms of equipment like electric beds, we have an ultrasound machine, we have incubators, we have ventilators, we have infant warmers, among many other disposables that are typically used in the hospital.
So everything is being loaded in the bus. I guess if they had bought a bigger truck, they would be getting more items. So we're hoping for them to come with bigger vehicles to get these items that are here.
Head coordinator for hurricane relief at the Portmore Islamic Center, Karima Munsi, told TVJ News that the community has realized that the needs across the hospitals are great, and so there are plans to do more.
If we didn't start this, we would know the needs of the hospital. So we're hoping to continue with Helping Hands to supply nebulizers and different equipment for the hospitals.
She said following consultations with several hospitals, she was informed that there is an increased demand for more treatment for asthmatic patients.
Simple things like asthmatic drugs. I am asthmatic, and I really think that asthmatics should always be treated as emergencies. As simple things like nebulizers, we know that we'll be on a campaign after this, hoping that we can get nebulizers to all hospitals.